All right, so India's service sector activity moderated further in January as new businesses didn't rise as fast as they were recently. So the PMI slumped to 51.5% in the previous month, marking the slowest expansion in 6 months. For the 6th month in a row, the service sector at least witnessed an expansion. So that is good, but the rate has slowed down. So possibly could be a lot of reasons. The third wave saw restrictions coming in. The service sector got hit the most, as it usually does. The inflationary pressures and consumer demand has also been sluggish. Now, what we're going to talk about today is what needs to be done to bridge this gap in the economy that we're talking about. It's become a political issue of sorts as well, with opposition leader Rahul Gandhi talking about two Indias in parliament. Finance Minister Nirmala Sitharaman spoke to the network today and talked about how it is the BJP who's trying to bridge that gap and the Congress has created it. Nevertheless, the fact is that the gap does exist. We can see it in a slew of data, and it could possibly be widening because of the effects of the pandemic. So to speak on this, I'm joined today by D.K Joshi, Director and Chief Economist at CRISIL, and Dr. Sachchidanand Shukla, Chief Economist at Mahindra and Mahindra. Welcome to both of you, and thank you so much for speaking with us today. Mr. Joshi, let me begin by just getting your overview on services PMI. Yes, we're seeing that as an impact of the pandemic. But do you think that we're going to continue to see this K-shaped recovery, as people are calling it, where some are doing better than the other when you look at the economy as a whole?
Well, I think it is going to continue for some more time, and this is not a phenomena which is only happening in India. It is a global phenomena. The inequality globally has risen. It was rising in any case. So what the pandemic did was it gave it a booster shot as well. So I think there is definitely gap between the haves and have-nots, I think, which has now expanded, and part of it will get corrected as I think as the services sector bounces back. A lot of urbanites who are underemployed or do not have proper employment, they can come back to the workforce, but that's going to take time. I mean, that for that the virus has to lie low for a significant period of time, because I think beyond that, I think there's no self-correcting mechanism for inequality in the system. I mean, so typically the governments get in and support the weaker parts of the economy. And here I think the strategy that the budget has outlined for that is that they're not going to give handouts, or not going to give a consumption boost in the short run, but they're going to do something which is more sustainable. I mean, so it may not have an immediate payoff, but you will see growth, rising sustainability that will eventually lead to more jobs. And I think so that is how it will filter through to the rest of the economy. So the choice between pushing growth up and redistribution, I think, is in favor of pushing growth up.
No, absolutely. Pushing growth up versus handouts is the way things will work. The question is the speed and why we're seeing this disparity. Dr. Shukla, if you want to come in on this, and we had this conversation earlier in the context of rural demand, seeing sluggishness. We're seeing that in some of the numbers that are being reported on the tractor front as well. Do you think this is a seasonal issue, and will the receding COVID numbers fix this? Or do we need some intervention on a policy front?
So I think, Tamanna, if you look at what's happened over the last 2 years, the virus is still not gone away, right? And therefore, the inequality that you're talking about, this is something that's been endemic to the system, to the Indian economy. All emerging and low-income economies have been going through that. What the virus or the pandemic has done is it has accentuated the differences between the haves and have-nots. So whether you are a government, whether you are a corporate, whether you are an individual, this chasm has become much wider. And I think an important thing to note is this virus has not been an equal opportunity virus. What I mean by this is it hurts the poor and the have-nots disproportionately. Just look at the US. It's one of the, say, most advanced economies, and yet it has had the highest number of cases in terms of deaths, in terms of, for example, the kind of impact the virus has had on the economy or the poorest segments. It's been one of the worst in the entire developed world. So I think it just exemplifies that this virus has not been an equal opportunity virus. And this is just accentuating the differences between these haves and have-nots. What can be done? I think the very first thing, which is very, very clear, is that the pandemic policy is, or the health policy is the best economic policy or antidote. Unless this goes away, we will continue to struggle with this. So the very first thing is getting people vaccinated, tracking and ensuring against these downside risks, I think is very, very important. The other is, like Mr. Joshi mentioned, there has to be a comprehensive program to reduce this inequality. And for this, we need to rewrite the rules of the economy, right? We will have to look at a new social contract, which is not just about tax the rich and distribute to the poor and more redistribution. It will require a slightly bigger welfare state. It will be about fundamentally reordering and equalizing the opportunity and security that has to be distributed across the society. And I think this is something that we will have to look at, not just India, but globally. I think this is going to be the biggest challenge of the decade. And then one last bit that I want to mention, Tamanna, is if you look at the one of the latest IMF studies, what it tells is that people who've been impacted in terms of livelihoods, the younger generation has been impacted, will be impacted in terms of livelihoods, because they will forego, if they've not gone through the education and not skilled properly, they've lost 2 years of schooling. When they enter the job force, they are likely to forego incomes of up to about $17 trillion. And this is a lesson from the GFC. This is something that is very visible in the United States of America.
You know, a lot of experts are of the view, and yesterday I was having a conversation with Ratan Roy, and he said that if you really want to improve things, get growth back, just open everything up. And I want to take this question to D.K Joshi, because look at what's happening in the last few days. A few days ago, Denmark said we're ending all COVID restrictions. Sweden made that announcement today. More and more policy makers are saying that there's no point of these restrictions. We have the vaccine, whatever happens next happens. The restrictions are not really helping. Do you think that's the way to really go? Because you can invest in a business, you can make future plans as an individual, citizen, if you know that you won't suddenly have the rug pulled out from under your feet once again, like we saw in the last part of December and the early part of Jan.
Well, I think here I'm not an epidemiologist, so I can't offer the best solution. And I think, as Dr. Shukla was saying, I think you have to keep the disease under control. I think the objective of restrictions should be limited to ensuring that there is not enough pressure on the medical system, that it is able to handle it. I mean, because if the virus starts spreading faster, I think the pressure on healthcare rises. But if you have noticed, I think every successive wave is less harmful to the economy, and fortunately, the virus is becoming less virulent, so to say. So I think in this case, I think we can experiment more with less restrictions, because the larger part of the population is vaccinated now, and unless I think a new variant comes which actually changes the game again. So I think you'll have to very cautiously play it out. And I think the WHO yesterday or day before yesterday talked about not taking it easy, because there are more variants which are likely to come. So I think it's something that you have to keep. You have to be very agile to the situation and keep changing the strategy as is required by the present situation. So I would say that now I think this Omicron did not hurt us too much, and it actually seems to be receding in some parts. So we are seeing differentiated restrictions. I mean, the restrictions are almost are quite less now. I think in cities like Mumbai or even in Delhi, they are. So I think this will continue. I mean, I'm not too sure. I think only an epidemiologist can say that which is the best strategy, whether it is to completely open. But I would say that a middle path where you tread cautiously.
No, so I agree. This is not an epidemiology question. I agree, Dr. Joshi. This is not an epidemiology question. And frankly, at this point, there are different kinds of responses coming in. The reason I asked this question, let me take this to Dr. Shukla, is that the response from these governments that I talked about globally is seeming to come from a place where they're now saying that restrictions are not really helping, they're harming more. And Christine Lagarde, in fact, echoed what D.K Joshi just said, that every successive wave is having less of an impact. Do we now have to recalibrate our response as well if we truly have to help things like a widening income equality gap? Because the fact is, when the restrictions are coming in, the most vulnerable in the economy get hit the hardest.
Exactly. So I think if you look at the responses, Tamanna, of various governments and also the state governments within India, look at the responses. They've been very, very calibrated. If you look at wave 1 versus wave 2 or the latest Omicron episode, you haven't seen the kind of stringency that you've seen in the previous episodes. Also, if you look at the medical and the healthcare responses, in terms of whether it is treatment, whether it is, say, the isolation, period, all of that has been calibrated as per the virulity of the particular wave. So I think we are learning to deal with the virus with every successive wave. We cannot at this point in time be very sure that the next wave is going to be as, say less virulent or more. And as you know, in Greek alphabet, we've just reached the 15th alphabet, right? That it goes all the way up to 24. So I do think that our responses, economic responses, and also the resilience of economic and business entities as well as individuals is evolving with each successive wave. We are putting to test the learnings that we've had from the previous ones. And therefore, look at what the government is now trying to do, for example. We have had two choices, whether to go in for consumption, which also involves opening up everything at the same time, or trying to go the capex way which the government has chosen. Now, it is very clear that if you do capex, we all understand the multipliers that it has, but also in terms of livelihoods, what it does is it distributes this across the country. So if, for example, the government strategy is the Gati Shakti program, where you have 7 engines, roads, railways, airports, ports, etc., right? What it does is that these projects are distributed across the country, and the jobs generated, therefore, will be to different corners of the country. And the people, the K-shaped recovery that you spoke about, the informal jobs, I think it also takes care of that. So I think our response, also, if you look at how the central government is dealing with it, how the budget is trying to look at it from the next, say, 12, 24 or 36 month perspective, is that we are learning to deal with it. And I think the responses have been better in each one of these waves. You can see that in statistics, the number of deaths or the impact on lives or the livelihood. So look at the hit on GDP, look at IIP, look at PMIs or the export numbers. The proof is in the pudding, right? So we are learning to deal with the virus better, but you cannot be sure. One thing that we've learned, Tamanna, with this virus is you cannot let your guard down. The moment you do that, we've seen the best of economies. I just gave you the example of United States of America, and look at the kind of impact it has had on the economy. The GDP numbers have been brought down. Look at the IMF's latest estimate for the world and for the US. It has been pared down. So I think we should not take it lightly. Having said all of what I just spoke about, our responses being better calibrated and we being better geared to tackle the virus going forward.
Yeah, no doubt. Nobody is suggesting that we just forget all about it and just ignore the virus, because it won't allow us to do that, I'm sure. But having said that, I think it's important to bring the focus on some of the challenges we face right now. And an economy that is recovering unevenly, where vulnerable sections are hurting, cannot be something that anyone desires or can allow for too long. So with that point, I would like to thank all of you for joining us on the first discussion this evening.
Thank you.
Thank you, Tamanna.